So I decided to become a urologist because I really enjoy being involved in somebody's healthcare from the beginning, the middle, and the end. Kind of seeing, the diagnosis being made, providing the treatment, and following that patient up. And urology provides a really unique sort of opportunity to do that, not only in kind of quality of life, but also quantity of life issues. Quality of life issues being sort of the classic urinary symptoms, certainly kidney stones causing pretty significant hindrance to quality of life, but also to cancer care where we're worried more about quantity of life. So there's really not a better field of medicine, in my opinion, to be a part of, to be able to do a little bit of everything and a little bit of everything before, during, and after, and not just sort of seeing people and sending them on their way after treating them. So being able to develop longitudinal relationships with people and really get to know who they are and see them frequently over years and years and years is really why. So I grew up in East Tennessee in a small town of Oak Ridge outside of Knoxville, known for the National Lab there. So I talked to a friend whose dad was an anesthesiologist down at Hopkins, the med campus, and he agreed to let me spend a week with him and just see a little bit of every type of surgery, what cases he was going to that day. And just going there, I got to see how surgeons talk to patients before, after, talk to their family members, see all different types of surgeries, and also see medical providers and non-surgical providers. And I just kind of knew that medicine was for me. Never looked back. Ended up going to med school at Hopkins because I just loved it there from those connections. At the end of that, or during that, I guess I should say, I met my wife, who is also a physician, and we both were doing training. So we ended up going to Ohio State and Nationwide Children's Hospital in Columbus, Ohio, for our sort of joint trainings together. That was 5 years of training specifically in urology. And then we moved back to the Mid-Atlantic because that was both of our homes and where we met. And we are here to stay. So I'm a big believer. I think I learned in one of my first years of medical school from a mentor that they always told me, treat the patient, not the pictures, not the labs, not the pathology report. You treat the patient. So, I always try to go into every patient encounter thinking, okay, well, who is this person? Where are they coming from? What have they been through in their life? And how can I sort of give my advice and my medical professional, opinion and expertise on what they're going through, but put it into the context of, what their life is and their life experiences. And I often use the analogy with my patients that I like to think of them as being in the driver's seat and I'm in the passenger seat holding the map. And I like to show them all the different places we can go, and here's how we get there. But ultimately, they ultimately make that decision.